our next guest is openly sharing the journey of taking Ozempic. Please welcome Ali Hashemi, the co-founder of GluCare.Health, and of course the team at Metabolic. Ali, good to have you with us.
Thanks for having me.
So talk to us about your story. I mean, obviously it's a big decision to take, and it's obviously one you didn't take lightly as well. But why the big O?
Look, there's a lot of reasons,
Yep.
and most of those reasons were clinical, and most of those reasons built over time. So in my younger days, when I was in medical school, I think I spent more time in the gym than I did in my books. So I was in quite good shape. But you know, as you get older, life changes. You have kids, you have a profession, you travel, and slowly but surely, I went from the proverbial six-pack to none at all, or the one-pack, whatever you call it. And that is a slow journey, right? You just sort of don't really even notice it, and before you know it, the guy that's looking back at you from the mirror is almost unrecognizable. So that happened to me. And it was through, probably over a decade. Started with actually an injury. So I had a big knee surgery and a big shoulder surgery, and that was it in terms of fitness for me for a while. But the key trigger for me was not just the weight gain. It was the fact that, once I opened GluCare, which is a metabolic health center, we have a lab in our basement. So I started taking my own blood all the time and just testing. I caught the moment I became pre-diabetic. So on top of having excess weight, primarily around what's called android obesity, which is weight around your organs, I also had high cholesterol, I had a fatty liver, and I became pre-diabetic. Now my grandfather died of complications related to diabetes. So that for me was kind of the real wake-up call.
Yeah. And Ozempic was the solution?
It was part of a broader solution.
And this is key, isn't it?
This is key, right? So too many people approach the medication as almost the silver bullet.
Yeah.
It's not that.
Yeah.
And candidly, most people who are taking these medications without proper oversight, good baselining, good management of dosing, good management of side effects, generally speaking, they're likely to produce poor outcomes. What does a poor outcome look like? It might mean that they dose too fast, too hard, and they get side effects that are unmanageable. Sometimes they can end up in the ER with extreme stomach pain, even stomach paralysis in very rare occasions. But also, a lot of people drop off because it's just unbearable, and that's a consequence of ramping up the drug sometimes too fast or not managing the side effects appropriately. But the more pernicious side effect long-term is that people start cycling. Like with any fad diet, right? You can lose, and you can regain, and then you lose again, and you regain. Each time you cycle, you actually don't just lose fat. You also lose a significant amount of muscle mass. And that balance or imbalance that's created, a little paradoxically, can mean that you will end up fatter than when you started.
Wow.
Because if you lose muscle mass and then regain fat in place of it, it's what we call sarcopenic obesity. And that's a real thing. It's a real thing that is more and more becoming talked about in the medical community, and hopefully now also in the general community, people will educate themselves on the right way to approach these medications and weight loss in general. But it's not just about the drug. So in my own journey, right? This was back in 2021. We were among the first clinics in the world to start using GLPs as part of a medicated weight loss journey. And I failed my first time. So I lost about 18 kilos in about 6 months, reversed everything. Prediabetes gone, fatty liver gone, high uric acid gone, everything back to clean bill of health. And I was like, great, I can stop the drug. So I kind of stopped too quickly. We were just ourselves still learning protocols, because this class of medication, we as a metabolic health clinic, we're using them for diabetics for a long time. And it's a different protocol, right?
Yeah.
So using them for weight loss is a different approach that one has to learn for each patient. What is the right sort of dosing curve? I came off quick because I thought, you know what, I met my goals and I can come off. I don't want to be on these injections and expensive drugs anymore. About 8 months later, we go back to the US, travel with the family, In-N-Out Burger, Krispy Kreme, and Disneyland, and suddenly the weight came back. But more importantly, the prediabetes started creeping back.
Wow. Okay.
So I had to go back on it again. Now, why did I fail? The primary reason, other than coming off the medication too quickly, is that I hadn't done the homework. I hadn't done the nutritional changes I needed to do, both in terms of the composition of what I was eating, but also the quantity, Once the appetite suppression went away from the drug, the appetite came back. And I started eating more than I needed to. I hadn't made fitness a routine. The second time around, personal trainer to the house 3 times a week, yoga twice a week, football, paddle, every day I've got something, and that became a non-negotiable. And then the third thing, which is hard for everybody, but it was especially hard for me as an entrepreneur building a business, my sleep was horrible. I was getting average 4.5, 5 hours of sleep, and you gotta treat sleep like it's a job. You gotta be methodical about that, non-negotiable about that. And once I started tackling these basic building blocks, now today, I've sort of kept it off, kept myself more importantly off the pre-diabetes axis, and most importantly, it's more likely that I'll be around for my grandkids, right?
Quite right.
Ali, it's very extensive what you told us. You know, that pretty much answers all our questions, really. But
I can leave.
Thanks so much, Ali. It's going great. Yeah.
what I do want to know, so you had a good reason to start Ozempic. But what about people who just want to do it for weight loss? What are the key things that they have to consider before they jump into it?
So there are clinical guidelines around the use of these medications. And those clinical guidelines are a derivative of how the pharma companies have tested the product. So they've gone through rigorous clinical trials. The data from those trials are submitted to the FDA, and the FDA comes up with approved guidelines. And those guidelines do evolve and change. So Ozempic was initially clinically approved for diabetics. Then they noticed that diabetics were losing weight, so they did new studies, and then the FDA approved it for weight loss. Well, Ozempic and Wegovy are the identical drug, but Ozempic is for diabetes, Wegovy is for the weight loss application. It's the same actual medication. Now, within those clinical guidelines, there are some standards. So either you have a BMI, a body mass index of over 30, or a body mass index of over 27 with another, what's called a comorbidity, something like prediabetes or high cholesterol, some other issue that connected with your underlying weight becomes an eligibility criteria. It's not advised if you just want to lose a couple of kilos to fit into, an outfit to get into, to go to a wedding party. That's probably not a good application, and I would say that the outcomes will not be good in the long run if that's the approach. We always encourage our patients to follow guidelines, do it under supervision, but really important is to baseline. Understand where you start so you understand where you're finishing.
So Ali, I mean, you mentioned there that, there should be a criteria for people who are wanting to use this drug, but we all know that we can walk into any pharmacy here in Dubai and pick up this drug. So what do you think are important steps that the health industry need to take to try and curb this, people just going out and purchasing it and not using it, in a sensible way?
That's a really good question and a tough one. I mean, there's obviously a regulatory question that's probably above my pay grade, which is that, preventing the pharma companies, not the pharma companies, but the pharmacies themselves, of dispensing medications without proper prescriptions and so on. So that's a problem out in the market. I unfortunately can't control that. I'll tell you what we can do and what we have done to encourage people to come in and get regularly tested. So we launched a program at GluCare called Zone Access, and it's a very affordable way to get every month physician visit, body composition analysis, and constant oversight on dosing and side effects for a very sort of affordable monthly price. The unfortunate reality is that these drugs, when used for weight loss, is not covered by insurance. So regular testing and regular visit with physicians, you'll have to pay out of pocket. That's just the structure of the healthcare economy here. So people, when they're paying out of pocket, they're sensitive to how much they're spending. And if you're faced with a 600 dirham bill every time you go see a physician, you're not going to be, doing that very often. So we've tried to create a program just to get people with minimal expense in so they can get the right oversight.
Okay, perfect. Well, thank you so much, Ali, for that insight. You're going to be staying with us throughout the show
Yes,
and sharing more valuable information, because I've got a million questions that I want to ask. And coming up, we'll be discussing whether purely lifestyle changes are enough to combat obesity, or if medication would be the only way forward for high-risk individuals. So stay tuned.